Hi, I am Dr. Anil Sharma, working as head of the Department of Neurosurgery in All India Institute of Medical Sciences, Raipur. So first, let's understand what is Parkinson disease. Parkinson disease is a progressive neurodegenerative disorder which lead to loss of neurons in the brain and resulting in loss of dopamine. The dopamine is neurotransmitter which is primarily responsible for smooth coordinated activity, and that lead to symptoms of abnormal body movement, tremor, bradykinesia, slowness of movement, and abnormal movement in the body. These are motor symptoms. Along with, there can be non-motor symptoms also, which can be lack of sleep, altered bowel habits, and cognitive decline. So this is the basic pathology. So this disease affect almost 70 people in the out of the 1 lakh population, and that can be younger and elder population also. Transmission of this disease, it's true that it cannot be cured completely, but with modification of drugs and deep brain stimulation and progression of this disease, particularly that modification of symptoms, neuromodulation of that symptom, that can be done, and that can lead to improved quality of life in the patient. So let's understand what are some misconceptions. There are some misconceptions like it's a disease of elderly. That's entirely it's not true. Though predominantly it affects the elderly population, but a younger person that also can be affected in this disease. As far as deep brain stimulation that is considered, so there is misconception like all patients of Parkinson disease are candidate for deep brain stimulation. That's not entirely true. That depends on variety of factors, including duration of the disease, symptoms, severity, and response to the drugs. Levodopa is the primarily cornerstone drug for management of this disease. So first, let's understand about the procedure of deep brain stimulation. Deep brain stimulation, what we do, this is a kind of brain similar to cardiac pacemaker. This is also called brain pacemaker surgery. So in this, what we do with a minimally invasive technique, we implant a fine electrodes in the brain. That implants are connected to the brain pacemaker that is placed below the collarbone in the chest. It's similar to that cardiac pacemaker, and the role of this pulse generator is to send signal to that fine electrodes by a extension. So there are three parts of DVS system. One is fine electrode, one is extensor, and one is pulse generator. So this pulse generator sends signal to the brain. That's why it's called deep brain stimulation, and that helps in alter that circuit, and that lead to modification of an improvement in the symptoms. So this part is during first procedure, while placing electrode, patient is usually awake. That means patient is conscious throughout the procedure, and it helps us in identifying proper target, and we can assess the response to the electric stimulation during surgery. And for next part, while placing brain pulse generator, that during that part either patient is placed in sedation or general anesthesia. So it's a completely pain-free procedure and fairly safe procedure. It's minimally invasive technique. After that, it can be modify also that during programming and all. So say yes to DBS, deep brain stimulation.
Say yes to DBS.